to check out Kev, our patient's here's feet. He's been having some foot pain and stiffness while running and a little bit after running. So we're gonna take a look, palpate, and potentially adjust if we find any fixations, okay? So first we're gonna have him lay down and we'll go through a couple foot palpations. Okay, so we're gonna palpate the talocrural joint and the midfoot, and we're gonna kind of see which one of those is kind of more at the root of the issue, because those are two very common areas that are restricted when people are having foot pain. And as you can see with Kev here, just visually, he has high arches, which those are gonna be usually implicated in people with higher, stiffer arches like that, okay? So first thing I'm gonna do is check the talocrural joint. So I'm gonna stabilize the tibia as I push on the talus and see how those glide in relation to each other, okay? And as I push through here, I'm actually feeling pretty good mobility through the talocrural joint. So I don't believe that that would be necessarily what is giving Kev issues right now. So we're gonna move on to the midfoot, okay? So, and as I said before, you can see that Kev has higher arches, which that tends to lead to stiffer midfoot joints when you see people with higher arches. So not always, but it is a good correlation. So let's take a look at that. So what I'm gonna do here is I'm gonna stabilize, back here, and I'm gonna kind of glide through the midfoot just like that, okay? And I'm just gonna kind of work my way down and see where I'm feeling any restrictions. And I can see here, near the forefoot or the ball of the foot, that's moving very well. You can see how well that's moving. And then when I grab in here and try to push, it's a little stiffer. You can see it's just not gliding as easily, okay? So I think that the midfoot is kind of where we're feeling some restrictions. So now I'm gonna set up a nice adjustment on that midfoot, and we're gonna thrust and mobilize the midfoot, okay? Okay, so for this adjustment, what I'm gonna do is I'm gonna contact the midfoot with my middle three fingers here, and then I'm gonna kind of tissue pull like this and internally rotate the leg right before I thrust, right? So just like that, reinforce my contact with the other hand and bring them into dorsiflexion, okay? And I'm gonna lean back and thrust. Good. Let's see how the other one goes. So same thing, contact the midfoot and tissue pull like this while I internally rotate, reinforce with the other hand, bring them into dorsiflexion and thrust. So what you guys just saw was a midfoot dorsiflexion adjustment. And the idea of that adjustment is to induce dorsiflexion into that midfoot joint and help reduce pain and stiffness in the area. And that's super common in runners, athletes, or even just people that have high arches, okay? So if you know anybody that's been experiencing any foot pain or stiffness, refer them to our channel or to our website. We'd love to help them out. Thanks, guys.